it is time to announce our first empowerment speaker. Amanda Olson is an occupational therapist and driver rehab specialist. Amanda works at Health Promotion Partners and has over 17 years of experience working with individuals after a neurological diagnosis such as Parkinson's, MS, and ALS. Amanda is passionate about safety on the road and helping clients to achieve their goals. Be sure to visit her in the Empowerment Bar as well. Please welcome Amanda Olson.
Okay. So I am happy to take questions during this presentation as well. So if you have any questions and you don't want to wait till the end, feel free to jump in. It's kind of a lot of information all at once, but overall, we understand that driving is a very sensitive topic. A lot of you don't want to discuss it. You don't want to think about the possibility that one day you may not be able to safely keep driving. And where our goal is not to tell you to stop driving. Our goal is to just make sure that your skills for driving are still safe and that you look good on the road. So we'll talk about driving is a sense of independence, identity, freedom, especially those of you that don't have caregivers and you live alone and you don't want to think about other transport options. It can be very daunting to even start thinking about that. How am I going to get to the doctor? How am I going to get groceries? You know, COVID has changed a little bit of that. I know a lot of people get delivery on items that they didn't get delivery before, but overall driving is important to most people. There are consequences if you stop driving. So it's known to have poor health outcomes, an increased risk of depression, increased healthcare costs, and decreased access to care. So life skills, financial management, medication management, cooking. If those things are all breaking down at home and you're needing a lot more assistance with any of that, it can often be a sign that driving might also be becoming a problem for you. Falls, there is a lot of research linking falls and crashes. So individuals that have fallen in the past 6 months were 40% more likely to be involved in a motor vehicle crash. There's a walking test that we do with clients in our clinic and that some of you have may done with a physical therapist called the rapid pace walk. Those people that score above 7.5 seconds doing the rapid pace walk are at higher risk for falls. And a lot of people that are at higher risk for falls, when the crash happens, they are at fault. So, didn't move forward. There we go. So obviously Parkinson's has a lot of physical symptoms that could impact coordination, limbs for turns, parking, lane changes, the ability for controlled pedal management, smooth acceleration, and sustained braking. Reaction speed may be significantly impacted. Some people have already come by our booth in the Empowerment Bar. We have something called the brake reaction timer, and they tested out how quickly they're moving their foot from the gas to the brake pedal. So you're welcome to stop by later if you're curious what your reaction speed looks like. So decreased range of motion and strength, that's going to impact steering. So there's something called a spinner knob. So if somebody's having trouble using both hands, there's ways to make that easier. Maybe they just need a spinner knob to be more controlled with their steering. There's a signal turn extender. So if you're having trouble getting to your turn signal, we have a way to adapt that to make it easier for you. We either bring it over the steering wheel so that you can use your right hand instead of your left hand, or there's also an extension for the left one that just allows you to get to it a little bit faster than maybe you have to now. There's a seatbelt pull. It just goes onto the seatbelt, comes off, and gives, just like it sounds, an extension that you grab that instead of the seatbelt to make it easier to pull on for yourself. And then there's something called a handy bar, and that goes into part of the door and it just comes across like this, and it basically becomes a grab bar to make it easier for you to stand up from your seat. So you can use that as a passenger or a driver, and it will help you get in and out of the car easier. Tremors, obviously, we know can be a big thing with Parkinson's. Sometimes once we get in the car, we don't see the tremors. And a lot of you may already notice that. Maybe you have tremors affecting you in daily life, but when you get in your car, they don't seem to matter anymore. All right, visual disturbances. So Colorado, every state has their own laws in terms of what's required when you go to the DMV. Colorado just requires that you have 20/40 vision in one of your eyes, and that your fields, so periphery, is 55 degrees. So it's really not a high requirement for Colorado. We look at all of that when you come into clinic. If they're met, there may be significant changes in visual perception, even if that stuff looks good. And at the end of the day, an optometrist can override any of that. So even if you aren't meeting the Colorado requirements, if you go see an optometrist and they think that you're safe to drive, or they say, go see Health Promotion Partners and let's see if you're safe to drive, they can fill out a form that overrides the fact that your vision doesn't meet the requirements, but you're still allowed to drive. All right, so how would that impact driving? Scanning, awareness of blind spots, being able to make smooth lane changes. Parkinson's, one of the first things that we usually see decrease when it comes to vision is contrast sensitivity. So that's driving at night, driving when it's raining. If you're out driving and it's sunny and all of a sudden it becomes cloudy, does it become a lot more difficult for you to drive? Making curbs. So obviously the curbs in the road, unless the curb is marked yellow or some other color, it just kind of blends right in with the road. So some people might not be able to distinguish between a curb and the actual street. You might see that in your home when it comes to stairs. So if you're missing steps often, you're tripping, that could be a contrast sensitivity issue. Mild to moderate Parkinson's clients may be at higher risk for crashes on foggy days or times that visibility is lower, and that would be because your contrast sensitivity has decreased. Cognition. So awareness of your limitations, what we call insight. Are you aware of where you're struggling and how that may impact your driving? Short-term memory deficits, divided and selective attention, processing speed, and decision-making. All very important with driving. So when should you come see us? We really recommend that as soon as you get diagnosed with Parkinson's, you get a screen. And that might not mean that you come to us for a full eval that I'll talk more about later, which encompasses us seeing you in clinic, but also seeing you in the car driving. Maybe you just get screened by an OT that you work with, an outpatient, for your visual skills, your physical motor skills, and your cognitive skills, and just get a baseline so that in a year you can get tested again and see if you're staying where you were at or if you've declined a little. So I always suggest that you just get checked right away. There is a study out that says that caregivers of people with Parkinson's have been shown to be good predictors in how Parkinson's patients do on the road. So if the caregiver just has watched them in the home or has been driving with them and just feels something isn't right, the study has shown that it's typically accurate, that the caregiver is correct in feeling that something is off. And then if you get tested, we recommend that you come back and get checked again if things progress. So a lot of you, I'm sure, go to outpatient PT. You might not go to as much OT, but I would recommend that you, if you are seeing an OT, you just discuss it with them, because in the clinic, they can do the majority of the testing, like I said before, and then they can talk to you about whether they think that your clinical results are kind of questionable and they're concerned, and maybe you should come see one of us to get seen in the actual car. Or they may just discuss your results and say that they think you actually look really good right now and they're not too concerned, and then you both know. Always be open to bringing this up with your doctor in case they haven't discussed it with you already. So what happens when you come to see us, or I would say even if you work with an OT in the community, they will look at visual function, so contrast sensitivity, acuity like we talked about before, visual motor reaction time, divided attention, memory, motor and sensory assessment. So if any of you have had something called the MoCA done on you, which is a screen that OTs can do, physicians also use, that looks a lot at attention, executive function, visual spatial skills, and usually people score below 20, like 20 or below, we think you should probably be further assessed on that. Okay, so this is, so you come to us, we see you in clinic, we do all these tests, and then it's time to get in the car. So our car has a brake and accelerator on our side, and then we can just reach over really quickly to grab the wheel if necessary. And I can also reach turn signals very easily for someone else. I have a standard route that I take everyone on that allows me to look at specific skills of driving. Typically the drive is at least an hour, sometimes longer, but it also just depends on what you want, what your goal is as a driver. If you're someone that has already decided you don't want to drive on the highway anymore, or you just want to go to the grocery store and you know your trips are only going to be 10, 15 minutes, then I'm not going to make you go on the highway. And I'm not going to make you go do an hour-and-a-half drive. It's going to be too much for you. So we start in this low challenge environment. I start in residential neighborhoods, 25, 30 miles per hour, make sure everything looks good. And then we pick up the speeds. We do things like, I might ask you to find the nearest gas station, and then I might ask you to pull in. We go into grocery store lots often because those busy environments are a lot more challenging. People think I'm at lower speeds, it's safer, but the parking lots of most places are very busy. And if your divided attention is off, or if your attention is off, period, accidents can happen very quickly if you don't react fast enough to the pedestrian or the car coming around or these people that aren't using their signals and telling you what they're going to do. We can also do familiar environments. So sometimes people aren't safe to go out and drive anywhere and everywhere, but they're safe to drive to their local grocery store. They've been doing it for 20 years. They know how to get there. They don't need to rely on GPS. Not a problem. So we might go to your house, meet you there, and say, take me to King Soopers. Take me to your son's house, or wherever it is that you know you can drive based off memory, and you do all the time and you're not worried about. And we'll just kind of adapt it to your goals and your needs. So, so adaptive equipment, I talked a little bit before about the spinner knobs, ways to do compensatory strategies, so modify the driving route, avoid left turns, avoid driving during peak hours. Is there another way to get there? So I can think of a girl right now, she's not good at certain speeds, and getting to work was high traffic environments. It was just too much for her. She can't handle those speeds and high volume traffic. So we sat down and mapped out another way for her to get there, that she can stay at lower speeds, she doesn't have to make as many lane changes, and can she go this back route and safely get herself to and from work. So it may be something that you, at the end of our drive, that you're just given restrictions. So a restriction could be you can only drive in familiar environments. It could be you can only drive during the day. It could be you could only drive at speeds up to 45 miles per hour. So those are different examples of restrictions that could be placed on your license. So you're still cleared to be driving, you just have a restricted environment that you can drive in. At the end of the day, all our conclusions go to your doctor, and your doctor has the final say in everything. They're the only ones that can fill out the form that I'm going to talk about in a minute to make that final decision on your safety for driving. So So another thing, if your tremors are present in the car, there's resistive steering that can help diminish the effect of the tremors. There are special mirrors to enhance side vision. If you have limited trunk rotation or rigidity, that will help you. A lot of times, relaxation is just an issue. So we'll talk about, finding a way to reduce your stress and relax before you get in the car. And then maybe you just don't drive in inclement weather or at night, and that would be especially recommended if your contrast sensitivity is fairly low. And for reaction time, maybe we talk about you having a bigger cushion in between you and the cars in front of you so that you have more time to stop. So in terms of reporting, so this is what I'm talking about in terms of your physician. So Colorado is a self-report state. So what that means is that when you get given a medical diagnosis, your physician is not required to inform the DMV. Other states, that is not the case, but Colorado expects you to inform the DMV. So if you're given any type of neurological diagnosis, you should be telling the DMV. If you tell the DMV, they're going to ask you for a form called a DR 2401 form that can only be filled out by your physician, by a PA, or the 2402 form will be done by the optometrist. So it is their way of just acknowledging that they know you have been given this diagnosis, but you are still safe to be driving. So they just check off this box that says fit to drive, send it in, and it's just in your record at the DMV. It's the same form that if you come work with us and we find, okay, you can still drive, but it should really only be in familiar environments, or it should really only be daylight only, or 45 miles per hour or less. That is the same form that the doctor will then check those boxes and write in there what restrictions they think you should have to keep driving. Send it into the DMV. The DMV will ask you to come in and get a new license, and those restrictions will be printed on the back of your license. So many people ask, do I need this form? It's for your own benefit. The time it comes into play is if you were to get in a bad accident, whoever you get in the accident with wants to try to sue you. They want to try to pull your medical records. If they pull up your medical records and see that you have dementia, or you have mild cognitive impairment, or you have Parkinson's, they can try to say, well, they shouldn't have even been driving. They have this diagnosis. Whereas if you have the 2401 on file, they can't do that, because the DMV is going to say, we're aware that they have Parkinson's, we're aware that they have dementia, but they've been cleared to drive. They're safe to drive in Colorado. Whatever happened with the accident had nothing to do with their diagnosis. Still doesn't mean you're not going to be found at fault if you were truly at fault for the accident. But if you weren't at fault or for any other reason, they can't use your diagnosis against you. It just stays in the DMV. So it should be there like the whole time you're in Colorado, unless you move out of state.
My question was, how long would that be good for?
Yeah, so it's permanently in your record. And then if, so say they checked you right now for fit to drive, but then in 5 years you came to work with us and we gave you restrictions, a new one would get sent with the restrictions. Other than that, it wouldn't change. And it's not even known that it's like, if you got pulled over for speeding, the cop wouldn't take your license and know that you had a 2401 on file. The only time it comes out is if you were to get in that bad accident. So I just say it's like a CYA. At minimum, if you at least have in your medical record somewhere, you know that your doctor wrote in your medical record that they've discussed driving with you and they feel that you're safe and don't have any concerns. I would at least at minimum push for that so that you know it's in writing somewhere that nobody has concerns about your driving ability. So that's Colorado. If you live in another state, each state has their own way of reporting and what the DMV expects of you.
Yes, is the form required to be reported to your insurance company also?
It is, as far as I am aware, no. It just sits with the DMV. Okay.
We have another question.
Does the doctor have these forms, or do we need to download them offline or go to the DMV and get them?
It's a good question. So we hope that all the doctors have the forms. I don't think they all do. Most people that come to my office have not heard about this form until we start discussing it at the end of our drive. So I don't think it's discussed as often as it should be. When we see people, we send it to the doctor with the report. So we write up a report at the end of seeing you that discusses what we saw in clinic, what we saw on the road, and what we discussed with all of you. And then that report gets sent to your physician with the 2401 form. If somebody comes in my office and says, I don't want that form, I'm not going to force it upon you. It's your decision. I just say it's up to your doctor. If your doctor is aware of the form regardless and fills it out, there's really nothing you can do about that, because your doctor can fill that out at any time and send it to the DMV. But I won't send it to the doctor if a patient is adamant about not having it on file. Let's see. So vehicle safety. So cars have so many things to help you now. So if you buy a new car, there's blind spot detection, there's backup cameras, there's lane maintenance systems, crash avoidance. Those things are great. You still need to know how to drive. Your skills still need to be appropriate for driving, but we certainly don't discourage these things, especially if your fields have gotten lower, like your visual fields are decreased. A blind spot detection is going to be great for you. Backup cameras are going to be great for you. The lane drifting, there's even these cars that have lane assist, so they actually pull you right back into the lane. That stuff is definitely great, but you still need to have control of the vehicle on your own. So obviously no automation all the way up to full automation. Our cars, so we have 3 offices. We have an office in Colorado Springs, an office in Fort Collins, and my office is in Westminster. Some of our cars have these features. The car I have doesn't have these features. So we take that into account. We always ask you what type of vehicle you're driving. We'll go through all this. Most of you know this. So the avoidance systems, lane departure, forward collision, blind spot. This is great, the headlights that assist, so they pull the light to where you need it. Definitely helpful. These are good resources. So My Car Does What is where you can look up all these features and learn more about them. And you can also just plug in your make and model and it will tell you what's available for your car. CarFit is a great organization. I think things are still mainly virtual, but if you go to their website, it just talks a lot about, are you seated properly in your car? Are your side view mirrors set up in the safest manner? And it'll kind of walk you through that. When we did them live, we would have like the handy bar that I talked about earlier there with us, cushions, other things that can help you transfer easier. Road-wise is you can go there. So if you're on medications that you're wondering, could this medication be impacting my driving skills? You can go and plug in your medications and then it will show you what they anticipate that medication will do in terms of your abilities for driving. Things to consider. So do you feel like you're physically strong enough to keep driving? Are you cognitively safe? Have you discussed driving with your doctor? And are there technologies that you feel would make you safer? All right. Further questions?
Okay, we've got a first question here.
What wonderful presentation, and makes me certainly think, am I safe on the road? My question is, you didn't really talk about handicap placards. I have a hard time parking. And so when I pull into a parking spot, the extra space that the handicap spaces give me is a huge advantage.
Yeah.
But what is your advice for us?
I mean, did you get yours through your physician? Yeah, so typically that is how you can get the handicap placard. We can't assist with that, but I definitely would encourage it for the reasons that you're saying. Like sometimes, obviously, if your motor skills have decreased, you just don't want to walk as far. So it's more convenient to have a close parking spot. But the space that you get allowed to have in the parking spots will help you have the room to get in and out of the car, just like a van. I would completely agree with that. That's a good idea.
Okay, any other questions? I know we had a few
Somebody over
during,
there.
someone over here. Oh, I see him. Hold on.
I've got it. We're coming.
I've noticed that things that are behind me, whether it's in driving or putting on a shirt, there seems to be something changed in my ability to interpret geometry that's backward. Do you know anything about that, or is that something that's been brought up? The parallel parking is an example.
So to me, it kind of sounds like a visual spatial awareness, which obviously is seen a lot in driving. Does your car have extra features to help you, or are you just kind of struggling through it?
I go forward instead of backward.
Yes. So backup cameras obviously help with that. The cars that practically parallel park for you would help you with that. But yeah, it definitely sounds like a visual spatial thing. So if you start noticing with forward parking, or that you're getting out of your lane, you're not keeping vehicle centering or anything like that, that's probably what's going on.
Amanda, we do have a question on live stream as well. If you have a restriction, are you required to retest every so many years?
So anyone that comes to us with a progressive diagnosis, we write in our note that they should be reevaluated in 1 year or at the discretion of the doctor. It's not necessarily just because you have restrictions put on you that you need to get reevaluated. It's more about what your diagnosis is and if it is a progressive diagnosis. Because all of those, like none of us can predict what you'll look like in 3 months, 6 months, 3 years, but your caregivers and your doctors see you a lot more often. So if something's going on, we just hope that they will send you back to us or recommend that you get reevaluated.
Okay, is that all questions? Oh, one more over here, hold on.
I just wonder how you address hallucinations with Parkinson's and driving. Is that, I mean, I know it's not really something you can prevent, so
Right. So
how do you think of it?
typically if somebody is having regular hallucinations, they probably should not be driving. Parkinson's is, as with other diagnoses, as many speakers have already mentioned, you can look very different in the morning than you do in the afternoon. You could look very different one day than you look the next day. So a lot of that is, we hope that you just make a good decision, because when we work with you, it's a snapshot in time. We're with you for 3 hours. You might look amazing, or you might have very minimal deficits that day, and then you might look totally different the next day. So just make good decisions on today. I don't feel at my best. Maybe I shouldn't drive, or maybe I should only go to the grocery store and not do anything more involved. But when people come in, because there's medications that make people hallucinate as well. That's something we've been discussing a lot about. We can't do anything about that. And if that happens during driving, it's going to be a big problem.
Hi, I asked you this earlier and I don't remember what your answer was. So I'm going to ask again. I would imagine there's some of those tests that you do where you score fabulously on almost all of them, except maybe one, and that was like not good. Okay. So the question I have is about the not good one that I'm concerned about for someone. And that is, and I'm going to mention it, curbside, if the curbs, if, you know, I mean, you could drive slower maybe, but is that a perception? Is that going to like, oh, look for other things too?
So
And what about freezing? If you've been freezing, not every day, but you've known to freeze.
correct. So the curbs could be, it could be a contrast sensitivity issue that's happening, or it could be a visual perceptual issue. In terms of scoring very well and then not scoring well, that is why we don't just do one test or two tests on anybody. And I will be honest, especially with the Parkinson's population, a lot of times their in clinic looks worse and they get in the car and they do quite well. So that's why I always encourage people, you know, if you're nervous and you go get this screen and the therapist you're working with in the clinic is very nervous and your scores are not great, you just come do behind the wheel, because it's not all about the clinic and things can look very different on the road. There's something else I was going to touch on with that. Oh, the freezing. So there's also a client we had probably within the last few months. He had an episode like that, yes. So again, it's hit or miss. It could have happened during our drive, but it also couldn't have. So we probably would have cleared him, right? So that's the whole, so he approaching a stop sign, meant to hit the brake, instead he hit the gas, flew right through the stop sign, and then he couldn't get off the gas. So that's why we have a gas and a brake, braked for him, but like had to stay heavy on that brake until he could finally get himself off of the gas. Now that was pretty far into the drive. So if that had never happened during our drive, then that's something that if it happened with a family member in the car or somebody just reports that frequently happening with driving, yeah, probably safer to not be driving. Well, so we would probably have to find out why that's happening. So if you can encourage them to come for a assessment, I would do that. Otherwise, when you're driving with them, just pay attention to like when they're turning. So new drivers, you teach them the side view mirror should line up with just beyond the curb that you're turning onto. Like if there's a bike lane or whatever, the side view mirror should meet the line. That's when the wheel should start turning, not before then. So are they turning too early? Or is it a visual, perceptual, or contrast sensitivity issue?
Okay, thank you so much, Amanda. We appreciate your time.